Hi, I'm Juliana Loewen, and I'm here with Dr. Janna Bentley from Lakeshore Vein and Aesthetic, and we are talking about, we're continuing the Be the Best Version of You series, and our topic today is varicose veins, which I have so many questions about, so I'm really excited just to jump into the topic. Probably we'll just start with, where do they come from? Like, how are we getting these unsightly veins? Mostly in our legs, right?
Yes.
Is that the main?
I feel it's like a pandemic. I'm joking, it's not. They're common, and as you get older, they are more common. So you would say maybe 80% of 80-year-olds have them, 90% of 90-year-olds. But the main reason we have them is genetics. So
Okay.
And the way it's inherited, it doesn't skip a generation. So it's one of your parents that passed it down to you. They might not have it as bad as you, or you might have it better than they do, but that's how it passes along. And aging. So aging and genetics, pregnancy accelerates it, but it's not the only cause of it. And multiple pregnancies, it's not even necessarily multiple pregnancies, but each pregnancy has the risk of it happening, and then any pregnancy after that makes that worse too.
It's like compounding.
Yeah.
Yeah. Pregnancy ones, can they go away on their own once you've lost that weight, like that extra pressure of carrying that weight?
It's not necessarily the weight, it's the hormones. So we sometimes assess people when they're pregnant just because they're having a lot of issues, but we wouldn't treat them until about 3 months postpartum because the hormones haven't settled down. Okay. And you want to not treat things that would go away on their own. But if you've seen them come up in pregnancy, it's a harbinger of what's to come.
Okay.
It means you've got that tendency there.
So what is the difference between a spider vein and a varicose vein?
So they're part of the same spectrum, the same issue. Spider veins are just a smaller version and a smaller vessel of the same kind of thing.
Okay, yeah. So in terms of natural prevention, if it's genetic, is there less you can do about that then?
You are going to get them if you have the tendency towards them, but if you wear compression stockings, that may help. I mean, no one can wear them 24/7, so it is part of aging, but that can make your legs feel better.
Okay. I've also heard that crossing your legs can cause them. Is that fact or myth?
It's a myth.
A myth.
But
okay.
I never cross my legs except for at the ankles.
Like the queen.
Yeah. That's probably why she does that.
So in terms of procedures then, if I had varicose veins and I'm coming to see you, what kind of assessment would follow that?
So a person should get a referral from their doctor, at least in BC, because then that helps with treatments to be more covered by our healthcare system than they would be otherwise. I believe it's a spectrum, this condition, and so I don't think people should be faking symptoms, but we are there to maintain the health of the venous circulation. And so you would get a referral from your doctor and then come in, and one of our phlebology team members will do an assessment, often a nurse, and then I will come in and confirm it, and then we have different options depending on what you need done. One thing is that it's incurable, so it's something you manage. It's like going to the dentist. You don't go once in your life and your teeth are clean for the rest of your life. You need to maintain it.
Okay.
So.
And is that because of what's, like, biologically, what is happening when you have a varicose vein?
Good question. So veins are the poor cousins in circulation. So arteries are the ones that get all the glory, heart attacks and strokes and aneurysms and high blood pressure, diabetes. Those are all related to arteries, and they're the vessels of supply. So they bring fresh blood from the heart and lungs to our different body parts, and then the veins return it when it's been used. So then it gets refreshed in the lungs again. So
okay.
Arm veins aren't prone to being varicose because they don't have to work against gravity the way leg veins do. And the way leg veins bring the blood back to the heart, our calf muscle does 70% of the pumping, and so high heels are actually hard on a person if you're prone to varicose veins, because you're not activating your calf muscle pump the way you should be. So the muscles squeeze, and then there's little trap doors inside the veins that open and close. The blood is pushed through, and the valves should hold it so it doesn't fall down again because it's going against gravity. But the weakness in varicose veins is in the valves. So you get backflow. And so then at that spot where the valve's not working, slowly the vein stretches because it's dealing with the extra, because it's kind of whirlpooling there because it's not getting out properly.
Okay.
And then the whole thing stretches, and it's like an elastic. So veins are elastic tubes that should like expand and contract with muscle contractions, and if they've lost their ability to spring back because they're too stretched, then they become like a shot elastic and they just stretch bigger.
Okay. So not all varicose veins, though, are dangerous, right? So they're just mostly unsightly for the majority of us.
So I would say almost no varicose veins are dangerous. So they're not the veins of blood clots that are serious, like a deep vein thrombosis, a DVT. So it's not why you have your varicose veins treated, although a person with varicose veins is more prone to a deep vein thrombosis than someone who doesn't have them, but that's not the risk that we're trying to modify when we treat veins. We're trying to treat them for 3 reasons. So symptoms of heavy, tired, aching, throbbing, itching, burning, swelling, cramping, restless, then they're plain old ugly, and we don't want a person to get an ulcer when they're a senior, and it just shouldn't happen. Someone shouldn't have skin breakdown in their ankle area because they didn't have their veins looked after. Okay, so that would be a good reason to come and see a vein specialist then, if you had varicose veins, even if you're not having pain or whatever, but it's something that's degenerative essentially for old age. Okay. And you also, if you're assessed and you decide you don't want to do anything about it right now, at least you've learned. Like I've actually seen a 6-year-old who's starting to get varicose veins, and of course we're not going to treat a 6-year-old, but it was just reassuring to the mom to know that something can be done about them when they become more of a problem. Okay, yeah. So what are the most common treatments then? So I guess the first treatment, if you're having a lot of symptoms, would be compression stockings, but that's not getting rid of anything. Our mainstay of treatment, especially for the little ones, is called sclerotherapy, and it's where we inject a medication that's designed to dry up the varicose veins, and then they slowly dissipate over time. And so that is used on everybody. And then from that, we have stronger sclerotherapy, where we actually use the ultrasound to guide an injection of a vein that's a problem underneath, causing problems on the surface. So if it's one we can't see with our own eyes, we can get it with the ultrasound. And then from there we have laser, like endovenous laser or glue. And then there's different variations on that. And then we also have the old stripping and ligation. So they're all different ways of pruning the tree, basically. Okay. So if you, the first one that you were talking about, sclerotherapy, and that closes off a vein essentially, yes. And then it just dissipates. Yeah. Okay. Does that end up putting more pressure on other veins then? That's a good question. If you have a varicose vein, it's already putting pressure on the other veins around it because it's not doing its job. So it actually, in a sense, relieves the pressure on the veins around it. Oh, okay. Because our venous system is very redundant. You're never going to run out of veins. The deep system does 90% or more of the work. Okay. So when you have a superficial vein that's not working, you're better off with it not there. Okay. Yeah. And are these painful processes? What is the threshold there? Well, most things in life that are worth it hurt a little bit. Fair enough. Yeah. I guess if your veins are causing you pain, then okay. Yeah. And what is the timing? So is this like something people can book on their lunch break, or is there recovery from sclerotherapy? So the sessions themselves are about half an hour for sclerotherapy, and then a person is meant to go for a half an hour walk afterwards, and then they could go back to work. Okay, so it's quite
Non-invasive.
But on a 1 hour lunch break, you couldn't do it.
Okay. Yeah. So you mentioned a 6-year-old. Is that a common age to start seeing varicose veins? Or what is the most common age?
That's a good question. Yeah. So that 6-year-old was uncommon. But because they run in my family, I've taken a special interest in the incidence in kids. And there's a lot going on in kids that we probably don't notice because they don't have symptoms. And it's not worth doing anything about them when they're that age. But it does start sooner than people think. When you look at a person with really big bulgy veins, it probably was starting when they were an embryo. It just sort of progresses as we stand on 2 legs. So it takes, I don't know, I've heard the number 10 years to develop symptoms from having a varicose vein. So I don't know if you should wait till they're hurting you because they're going nowhere good on their own. So when do you start? I think when you notice them, at least find out about them and what you can do.
Okay. And then from there, it's a management process.
Yeah.
Yeah. Okay. So do you mostly see women, because you mentioned that they can be very hormonally caused?
So yes, so the big bulgy veins, that is almost 50-50 for men and women. But the smaller sort of day in, day out maintenance sclerotherapy that we do is mostly women because for one thing, well, it's the hormones. And also we shave our legs and we probably notice them more than men.
Okay, yeah. We're showing them off more.
Yeah, exactly.
Thank you, Dr. Janna Bentley, for coming in and talking to us about varicose veins, especially since they affect so many of us. And that was another episode of Be the Best Version of You.